Well, it's time now for our weekly segment with Dr. David Agus. He's ready to answer all your questions about COVID-19. Thank you so much for joining us, Doctor. So this is really crucial because we know that even though children over the age of 5 have the ability to get the vaccine, it's a very small percentage. A lot of parents are not taking advantage of this because they're nervous. And so now we have kids under 5 with access to the vaccine. We had several parents message us wanting to know which vaccine you recommend for children under 5, Pfizer or Moderna.
That's a key question and a tough one, but I'll just give you my honest opinion. And really, this is my opinion. If you look at the data, they both work. There is dramatically more safety data with that Pfizer vaccine. And so what I mean is that tens of millions of kids or hundreds of millions of kids across the globe have been given the Pfizer vaccine, and really only thousands under 18 have been given Moderna. So all that safety data, I favor the Pfizer vaccine. Less side effects with the Pfizer vaccine because it is a remarkably low dose, but it requires 3 shots. So a little bit more patience is required. If you want a quick time to immunity, the Moderna vaccine is the one. If you want lower side effects and a lot more safety data, the Pfizer is the one. And I would imagine parents favor the latter.
You know, masks are optional in so many parts of the country now. Lyft and Uber recently made them optional in New York and in New Jersey and New York, outside of New York City. And they've also lifted the front seat ban. One rideshare driver, you see the message here, says they still don't feel comfortable, though, with a passenger in such close proximity. They want to know whether that is safe with a mask-less person, or perhaps your suggestion is to wear masks anyway. What do you make of that?
Yeah, there's no question. There is some risk if you have someone next to you without a mask. I mean, it's obvious, right? This is a tremendously infectious virus. And so we all have a choice whether to get in that Uber car or that Lyft car or not. The problem is the driver has to drive to make a living. And so if there's a case where somebody's in the front seat, I would try to keep the windows open if you can, and then wear an N95 mask if you're that driver. You need to protect yourself, I agree, or bring something home to your family you certainly don't want. So it's difficult, but we have to do what we can to protect ourselves.
Okay, this question isn't exactly straightforward, so I'm going to say it slowly, right? This person wants to know if they meet with someone who has recently recovered from COVID, but their partner now has it, if the virus can be passed on from his partner. I guess meeting with someone like one COVID positive person removed is basically what he's asking.
Yeah, and so, you know, the argument, right, is if you got COVID, you have immunity. And there's this kind of internet myth. I have 90 days free. I can do whatever I want, hug whoever I want, kiss whoever I want. And unfortunately, that's not the case. As we're seeing with this new variant, BA4 and BA5, prior Omicron exposure doesn't really protect you from these newer variants. So if that person's partner had COVID within a few days and the partner is testing negative now, and the person is testing negative and the partner is positive. If they're testing negative, it's okay to be with them. If they're not testing negative, I wouldn't be with them. If that was COVID, weeks to months ago, again, I don't think there's protection there, and I would use caution.
Okay, so you're addressing that sense of natural immunity. I mean, that's not something that you want people to think they have post-diagnosis. I want to jump to this question since you've addressed that point. This is question 5 on our list. This person wants to know why second boosters are not recommended for people younger than 50. What's the news there?
Well, the real truth is that the government's efforts have been focused on getting the vaccines out for young kids. And I would imagine that boosters for under 50 comes next. The data are significantly positive. If you look at the data from Israel and Europe, they work in a younger group, and they do offer broader immunity that is critical. We will in the fall have new variant boosters, so we have an even broader immune response to protect us. And I think if you can get a booster now or you become eligible, get one. And in the fall, we'll probably have a new one to give us broader immunity against these new variants.
So I have a completely different topic to ask you about while we have you here. It's always good to have a doctor. There's a new report suggesting that taking daily vitamins and supplements to prevent cancer and heart disease is largely useless for most people. Just yesterday, Errol, we were talking about supplements, and I was saying my issue with supplements is you never know what's actually in the bottle.
I don't think there's any regulation.
Right.
Doctor, what's the word?
But I don't know about the effectiveness. That's probably like a whole other debate. But doctor, what's your take on this?
So we spend more on vitamins and supplements in the United States of America than all of medical research. We spend more on potato chips than we do on cancer research in the U.S. So this is something that is enormous for our country. There has never been a positive study in the history of man or womankind of a vitamin or a supplement showing a benefit with heart disease or cancer in a normal individual. And that is a hell of a statement. And the other side is there are real side effects. Men who take vitamin E have an increased risk of prostate cancer. Women who are elderly who take high-dose vitamin D have an increased risk of bone fracture. Smokers who take vitamin carotene and vitamin A, a dramatically increased risk of lung cancer and death. And by the way, death is a bad side effect to taking a pill.
That's an understatement, but yes, doctor.
I mean, it's a good point to make, considering so many people swear by these things based on how they feel. It's important to note there's no hard data to back any of that up.
No, and there's data on the counter side. I think this was a very important statement by the U.S. Preventive Task Force to say, hey, listen, there is no data, they work, and that's critical. You have to understand, vitamins came out when the fast food craze hit our country. They were the, quote, antidote. More of something doesn't make it better. And I think that's what's really important. I want every person to question, is there data that will benefit me for what I'm doing? And in most cases, the answer is no. So I would hold off, save some money, use it on something else.
I feel like we have to do a segment like this, just on vitamins and supplements, where we just like pummel in with questions.
That's right.
Dr. David Agus, you got to come back.
Thanks, Doctor. Great to chat with you.
Thank you, guys.
And if you have questions about COVID-19, send them to Dr. Agus. You can tweet him at David Agus, or you can text him at 310-299-9322. We'll have Dr. Agus on every Thursday morning. He might answer your question right here on the stream.